Hello everybody, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today is going to be a workflow video, and it's going to be on suggestions and best practice workflows, in my opinion, for refilling prescriptions for patients in your office. Now, I just want to preface this with, this is what my suggestions are. It's by no means supposed to be anything that follows legal guidelines. Every state is different. Different types of classes of medications require different things as well. So this is just going to be a very broad overview of suggested workflows, and then I expect whomever is watching this and they want this as a resource to go back to the medical director of the clinic, or if you are the medical director, and review how things work in your practice and what type of patient population you have, what kind of workflows are already established that you can put this into play with that, what kind of staff experience you have, because that will influence some of these decisions and workflows. But this is just to give some suggestions overall on things to think about as you put those specific policies and procedures into place in your clinic. The first thing I want to suggest is having different policies for possible different classes of drug medications. So that means if you do prescribe or refill Schedule II medications, then I would suggest having a separate policy for handling those medications than maybe you do the Class 3 and 4s. Also, depending on the reason for the refill, whether it's an acute need for the patient or an ongoing chronic condition that the patient refills the prescription, those will probably have different requirements and workflows as well. So just think about this, what kind of medications you prescribe in your office, what kind of patients you see and diagnoses, because that's really going to help guide you in this as well. And like I said, you can have a policy and procedure, but have little subsections under that for refilling different types of medications for different reasons. Schedule IIs are a whole nother element because the FDA really has cracked down on that, and the DEA, and there's requirements. So I encourage you to look all of that up and make sure that you're following all of the policies and procedures set out by your legal authorities, making sure that you're doing that all the way that you should be. Also, I would definitely make sure that whatever policy you set up with your staff in regards to refilling medications, that you have it reflected in writing so they can reference it if they need to. It's a source that you will have in case, God forbid, any kind of legal action were to be taken against you for whatever reason. You can show them that you have policies and procedures in this realm and that you encourage staff to follow it, or they will face disciplinary actions. So that helps back you up there. And I would also make sure that you have it in some kind of written form for patients to understand what your policies and procedures are as well, and what's expected of them when it comes to refilling medication. A lot of doctors' offices, if you listen to recordings when you call or you see a message on their portal, they encourage all patients to call a pharmacy and ask them to fax over a refill request on their behalf. There's a few reasons for this, and it totally makes sense, and a lot of patients get irritated by it, but once you explain it to them and the reasons why, I think they're a little bit more open-minded and understanding about it. The first reason is, what if there are already standing refills for that medication, and all that needs to be done is asking the pharmacy to refill that medication without having to get you or the provider involved? That's number one. It could save a lot of time for everybody. For two, the information that gets sent to the provider with that refill request is so informative. It has the name of the medication, the dose, the route, the directions, sometimes the reason why the medication is taken, who was the last prescribing doctor. I mean, all this information is very helpful, especially if a patient has transferred care to you, or you're taking over that prescription from another doctor that maybe they saw a specialist, but they've asked you to take it over as their primary care. There's a lot of different reasons. So it's good to have that information. So many medications sound alike. I mean, you have erythromycin and azithromycin, and patients aren't trained in the medical field. They're not usually healthcare professionals. And so they might mean one medication and say something else, and you misunderstand on a voicemail, or they wrote something down that was incorrect and the wrong medication gets prescribed. So it cuts down on a lot of possible errors, and it's a good patient safety thing to follow for this reason. Also, patients really don't know their dosage of medications, even if they know the correct name of the medication. And a lot of times they might say they take it once a day, but they're really supposed to be taking it twice a day, but they either don't realize they're supposed to be taking it twice a day, or they don't want to take it twice a day, so they're only taking it once a day. So it's good to verify and make sure that you're prescribing it the way that it's been prescribed originally to the patient for the reasons that it's been prescribed. Also, there's so many medications out there that have different indications, and doctors like to prescribe medications for off-label use, which is not unheard of and it's not wrong. It's just the reality of letting doctors be doctors and prescribe what's appropriate for patients given whatever conditions or diagnosis they have. And so that's another reason. So my suggested workflow for internal is, one, to make sure that all of your staff is advising patients to contact their pharmacy and have them send refill requests directly to your office. The second thing is you need to have set out parameters for how often patients need to be seen for certain medications or for having certain diagnoses. So if a patient is requesting a refill on a thyroid medicine, what we had to do in the medical office, the MAs would get the refill request, and we would look through the patient's chart to find out when their last lab work was done for their thyroid, what the results were, when's the last time they had a date of service, and when their last refill was. And then we were able to provide that information to the doctors so that they can make the fastest decision on, one, if they were going to refill the medication and how many refills, two, if the patient needed to be recalled back into the office for either just a lab draw or an office visit and labs, or three, they could give multiple refills and let the patient know when their next due date is for their visit and labs. That's the first thing. We had it all separated in our handbook by, or our policies and procedures book, by the different types of medications. So we had thyroid, we had, which was included in the hormone section. So that would also be where the birth control was, looking for the last PAP, the results of the last PAP, the last pelvic exam date, all of that kind of stuff. You know, all the guidelines that doctors follow for certain medications in order to refill them. They would have that all written out so that MAs knew what information to gather before we gave it to the doctors to preview and refill, because then they didn't have to go through the chart and look for all of that, and it made it a lot more efficient. For the people like me who were there a long time and totally understood how my doctor practiced, understood my patients, understood medicine pretty well for my role, I had a little bit more leeway that was laid out in written instructions and guidance from the doctor. So because I was a medical assistant, I don't have a license to work under things myself like a nurse does, so I'm working under the doctor's license. So depending on which state you work, and I'm in Oregon, there's different ways that MAs can work in their capacity. And so because the doctor, I was working under their license in Oregon, I had written instructions I could follow. So the doctor would tell me if their thyroid labs were done within the last 3 months, they were seen within the last 3 months, they could have a refill for this many times. Or if they're a diabetic and their hemoglobin A1C was checked and it was within these certain guidelines. I mean, it was very specific instructions for me to follow, but I didn't have to bother the doctor. I could see the information I gathered, check it against the written orders that he had standing for me to follow, and then I could refill those medications according to that. It all depends on, one, your staff's education, their knowledge base, their capabilities, the comfort level of your providers. But the key to doing this is making sure that there are very specific written instructions for those staffs to follow, and that they know they cannot go outside those boundaries. So again, it's really dependent upon how comfortable the doctor is with these specific staff members, how knowledgeable they are, and all of that kind of thing. I'm sure you get the point. The thing that everyone needs to remember with prescriptions is that it's patient safety number one, and number two is the liability of the provider. So you have to make sure whatever policies and procedures you put into place covers both of those very well. It is very good to stress in your office making sure and ensuring that people work within their scope of practice. So that means the MAs know that they're not able to give medical advice, that the nurses know that they have to work within their licensure, that the doctors and providers are aware that MAs work under their license, and whatever other, requirements are for your state in that regard and those capacities. It is always good, though, for prescriptions to come over in electronic form or paper form requests, because that ensures that the information is more clear, it's going to be faster, more efficient. Now, patients' communication in regards to the refills can be a little tricky. And I say that because sometimes patients like you to call them back when you send in the refill request. Sometimes you try to contact them through the portal. Sometimes they don't want you to contact them. And the longer you have a patient under your care, the more your staff will get to know them and understand this. But it's really good to set up some basic baseline formatted way that your staff will communicate with patients, and they're aware they will be communicated by your office that way. So if they need labs before you will refill any more medications, if they need an office visit, they need to know what to expect and where to expect it so that they can respond as fast as possible. The one thing that a lot of people don't understand, and they try to do this, is that if a patient owes you money and they have a high patient account balance, it's a very gray area, and I almost want to say not acceptable to withhold a patient's medications and treatments due to the high balance. It's getting into that ethical category, and depending on what communication has been made to the patient regarding this, you could get yourself in a lot of trouble. So before you practice that kind of situation where withholding medications or refills from a patient before they pay their bill that's outstanding, I would definitely consult with a lawyer or an attorney just to make sure that you're not going to get yourself into any legal trouble by doing this. It is appropriate to send letters to them to inform them of their balances, their past due balances, those sorts of things, but you definitely want to make sure that you're not going to get yourself into any trouble, because you don't want to put the patient into a situation where they could have life-threatening issues as a result of not having their medications or their treatments. I hope this helps. I know this was a requested specific video from a viewer, so if this doesn't specifically answer your questions or you have more follow-up questions, please feel free to reach out to me. All of you, if you have any questions or comments regarding this topic, please leave that in the comment section below. Smash the thumbs up button if today's video was helpful, and subscribe to my channel if you haven't already. I hope you guys are doing well. Take care of yourselves. Bye-bye.